Hello, this is Dr. Philip Mease, Director of Rheumatology Research at Swedish Medical Center and Clinical Professor at the University of Washington School of Medicine in Seattle, Washington. I will be discussing the abstract Safety and Efficacy of Tofacitinib, an oral Janus kinase inhibitor, up to 36 months in patients with active psoriatic arthritis, data from the second interim analysis of OPAL Balance, an open-label long-term extension study by Dr. Peter Nash and colleagues. This abstract was presented at the American College of Rheumatology meeting in November 2017. I selected this abstract to discuss because it provides confirmation on recently approved, in December of 2017, Tofacitinib, an oral Janus kinase inhibitor reporting safety, tolerability, efficacy, and sustained responses in all the key domains in psoriatic arthritis for patients with active PsA. Results were derived from a 36-month open-label long-term extension study, OPAL Balance. Eligible patients were included from two previous pivotal phase 3 Tofacitinib PsA studies, OPAL Broaden and OPAL Beyond, both of which were randomized double-blind clinical trials comparing Tofacitinib 5 or 10 milligrams compared to placebo in active PsA. All patients entered on a background of a conventional synthetic DMARD, as was mandated by the previous qualifying studies. Dosing continued as either 5 milligrams or 10 milligrams based on dosing in the primary studies. After 1 month, patients in the 5 milligram arm were allowed to increase to 10 milligrams twice a day for efficacy reasons or reduce to 5 milligrams for safety reasons. Primary endpoints including incidence and severity of adverse events, as well as change from baseline in laboratory values, in addition to efficacy endpoints. What were the key findings? 686 patients entered the study. 10.5% of patients had serious adverse events, and 7.6% discontinued due to adverse events. 1.6% reported serious infections. 2.8% reported herpes zoster events. 0.3% reported major adverse cardiovascular events, and 1.9% reported malignancies. There were no adverse events of gastrointestinal perforation or inflammatory bowel disease, and few patients experienced elevated liver enzymes. In terms of efficacy, 67% of patients had ACR20 response at 24 months. Efficacy was achieved in key secondary endpoints, including enthesitis, dactylitis, skin manifestations of psoriasis, function, and quality of life. Here are my thoughts and analysis of this study. The study showed a low rate, 1.6%, of serious infections. Over 36 months, the safety profile of Tofacitinib was similar to the pivotal phase 3 OPAL studies, as well as previous trials in rheumatoid arthritis. No new or different emerging adverse events were identified. These results support the sustained efficacy and relative safety of Tofacitinib in psoriatic arthritis.